was seen that 1 in 6 deaths from cardiovascular diseases was due to a stroke. Every 40 seconds, someone in the United States has a stroke. Every 3.5 minutes, someone dies of stroke. Every year, more than 7,95,000 people in the United States have a stroke. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about cardiovascular health and stroke, their relationships with risk factors. Genes and lifestyle factors together play a role in stroke risk. However, even for people at high risk for stroke, adopting a healthy cardiovascular lifestyle may significantly lower the risk of stroke in their lifetime, according to the new research published in the Journal of the American Heart Association, an open access peer-reviewed journal of the American Heart Association. For the study, researchers reviewed data from the Atherosclerosis Risk in Communities or ARIC study, a community-based study of more than 11,500 white and black adults over the age of 45 who had no history of stroke at enrollment. Study participants were followed for 28 years, 45% were men and 55% were women. Researchers estimated the lifetime risk of a first stroke according to levels of genetic risk based on a stroke polygenic risk score. Polygenic risk scores were derived from over 3 million genetic variants or single nucleotide polymorphisms across the whole genome. The number of single nucleotide polymorphisms related to stroke was standardized at more than 2.7 million for white adults and more than 2.2 million single nucleotide polymorphisms for black adults. The researchers investigated the potential impact of the American Heart Association's Life Simple 7 recommendations and whether higher Life Simple 7 cardiovascular score equating to better cardiovascular health lessened the negative impact of a high genetic score on the lifetime risk of stroke. Researchers found that at age 45, study participants with the lowest polygenic risk scores had the lowest lifetime risk of stroke, which is 9.6%. The lifetime risk of stroke was 13.8% for participants with an intermediate polygenic risk score and 23.2% for participants with a high polygenic risk score. Those with both high genetic risk for stroke and low cardiovascular health had the highest lifetime risk of stroke score of 24.8%. Participants who had a high polygenic risk and optimal cardiovascular health were observed to mitigate their lifetime risk of stroke by up to 43% compared to those with inadequate cardiovascular health. This translated into about 6 additional years without a stroke. Researchers ended that this was the first step in using genetic information to identify people who may be at a higher risk for stroke and also in motivating people to make lifestyle changes for cardiovascular disease prevention. This type of study showed the responsibilities for the future. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.